So dysphagia, in simple terms, it is said as unable to swallow food or water properly. Generally, this is seen at older age adults like geriatric population, where they might be having some neurological issues like Parkinson's disorders or after stroke effect, they will not be able to swallow the food properly. Or the symptoms could be they will be coughing every time they eat or drink, and their appetite might go down because they're not finding it good to eat, or the time of their meals will be increasing. So these are the symptoms you can identify and tell that they might be having some swallowing issues. So of course these issues has to be addressed much earlier so that the neurological identification of the problem or recording of the problem can be eradicated or deleted. So if you can treat these problems much earlier by giving a proper pattern of their swallowing, so brain will not even record that they had a swallowing issue at all. So how do we do this? So once you identify, definitely a speech therapist or a neurologist or deglutologist, there's a specialized study on the swallowing problems. So these people can help them identify which phase they have issues. It could be oral phase or esophageal phase or pharyngeal phase. So depending on these stages and why is it possible? Is it after stroke or as such the Parkinson's, the muscle movements are weak? So which is causing this problem has to be identified much earlier. So depending on that only the professional can give you a proper treatment and they will be able to swallow well. Once they are able to swallow well, their nutrition will be good and it will be in turn helping the other problems to solve or show good progress in the other problems as well. But again, we need to identify that what kind of food textures or food tastes they are avoiding. We can easily, the deglutologist or the speech therapist will help you easily change the texture of the food, which can make them feel that the swallowing is much more easier. And the temperature of the food, and also the way the food will be visualized by the patient. You can decorate some meals, a nice plate with a small flower or some nice syrups on it. So that will make them increase their appetite. So these kind of visual skills and nice smell and taste and correct amount of texture, rightly maintaining the timings of the food. So these things can help the geriatric population to encourage and come out of this dysphagia problems. Here I need to point out that not only adults, even children might be facing these kind of issues. So especially certain textures will make the children give a gag reflex. They will be vomiting certain things like leafy vegetables, tomato with some curry. So these kind of things might give over taste for them. They're too much of hypersensitive to that particular taste. So looking at their gag reflex, we might think that oh, this taste he doesn't like, so we need to avoid it. But the studies show that every taste can be given 18 to 13 times just to make them get adapted to that kind of taste. And if they are able to adapt to that kind of taste, slowly in that 13 attempts or 8 attempts, they are showing little acceptance to that kind of taste, then you can carry on with it. Still, in this 8 to 13 attempts, if they are showing any allergies or still they are getting more and more averse to that kind of taste, that's when we need to think that okay, that taste is not helping him much. We need to change a little bit outer taste or the texture of it can be changed. So not only geriatric population, even in children, we might be having feeding problems or swallowing problems. We can address these problems by again giving a proper oral structural movement or chewing. These are called vegetative skills. So once they achieve their good vegetative skills and the good reflex, a propulsion and a reflex to make a bolus and swallow the food, then they will be showing more interest to eat more food. So this nutrition is very important even for the child growth and the pediatric population to come out of certain problems. So who will be addressing these swallowing issues? As we have mentioned earlier, a deglutologist or a speech therapist can address this problem. First, we need to assess into which phase we have problem, and that can help us treat the problem much more easier and much more faster.